Huntington's disease. If you or someone you know is experiencing any symptoms that appear to be symptoms of Huntington's disease, contact a doctor. Huntington's disease is known as the monster disease. It is a combination of Parkinson's, Alzheimer's, and amyotrophic lateral sclerosis. So, what causes Huntington's disease? Huntington's disease is a hereditary disease. There is a 50% chance of having the disease if a parent has it. It is caused by a mutation in a gene for a protein called Huntington, HTT, located on chromosome 4. The gene sequence CAG, cytosine, adenine, guanine, is present in everybody, but someone with Huntington's disease has more. If you have 36 plus CAG repeats, you are diagnosed with Huntington's disease. Genetic testing can determine if an individual carries the mutated gene associated with Huntington's disease. 3 to 7 out of every 100,000 people are affected by Huntington's disease. Typically, symptoms arise between ages of 30 and 50. So, what are the symptoms? There are physical, emotional, and cognitive symptoms. Physical symptoms include trouble walking, loss of coordination, referred to as ataxia, slurred speech, and uncontrollable movements, such as jerking or twitching. Emotional symptoms include changes in personality, depression and mood swings, feelings of anger or frustration, and not understanding. Cognitive symptoms include memory loss and cognitive deficits and declines. It may be harder to complete simple tasks. When having these symptoms, you may feel defeated and at a loss. Let's talk about what a brain with Huntington's disease looks like. There is an enlargement of the lateral ventricles, an enlargement of the frontal horns, and there is gradual degeneration of parts of the basal ganglia called the caudate nucleus and putamen. Someone with Huntington's disease can have good days, which could look like less pain, less frustration, feeling more like yourself, and a positive mood. And they could have bad days, which might look like more physical pain, severe frustration, irritability, and worsening memory and understanding. There is no cure for Huntington's disease. Nothing can stop or reverse the disease's course. The goal of treatment is to help relieve symptoms. An army of scientists are working on treatments to help slow the progression of Huntington's disease. So, what research is happening to help treat and prevent Huntington's disease? Clinical trials are being done to help determine what medications are best, and what therapies should be used. Drugs that help to relieve symptoms are haloperidol, tetrabenazine, and amantadine. Haloperidol can ease symptoms of chorea by inhibiting the effects of dopamine and increasing its turnover. Tetrabenazine is a monoamine depleter and dopamine receptor blocker, helping to control motor movements. And amantadine has effects on cognitive and behavioral symptoms. Alongside medication, or by itself, there are helpful therapies to relieve and slow the progression of symptoms. Therapies such as physical therapy, occupational therapy, and speech therapy. Physical therapy consists of mild exercises, mind workouts, and help with balance and strength, as well as much more. Occupational therapy consists of helping improve functional ability with the use of assistive devices, like feeding tools, handrails, and stair lifts. Speech therapy consists of the improvement of verbal communication, strengthening of speech muscles, and speaking more clearly. So, how do you support someone who has Huntington's disease? Good communication is key, whether that is between the patient and doctor, or the patient and their supports. If you are caring for someone with Huntington's disease, make sure to take care of yourself too, and have your own supports. There is hope for future treatment.